Are you or a loved one struggling with epilepsy? Finding the right anticonvulsant medication can be a challenge, but fear not, as we delve into the battle of the anticonvulsants. A showdown between Dilantin and Lamictal for epilepsy relief. In this video, we will explore the effectiveness, side effects, and key differences between these two commonly prescribed drugs. For those seeking fast-acting seizure control and a long track record of success, Dilantin may be the answer. However, if you're in search of a more modern option with potentially fewer side effects, Lamictal could be the solution you've been looking for. We'll provide an in-depth analysis of each medication's mechanism of action, their potential interactions with other drugs, and the overall safety profile. Armed with this knowledge, you'll be better equipped to discuss treatment options with your healthcare provider. Don't settle for less when it comes to managing your epilepsy. Join us as we dig deep into the battle of these anticonvulsants and discover which one reigns supreme in providing relief. Disclaimer: this video is for informational purposes only and should not replace professional medical advice. Always consult with a healthcare provider before making any decisions regarding your treatment. What is Dilantin? Dilantin, also known by its generic name phenytoin, is a widely used anticonvulsant medication primarily prescribed for the management of epilepsy. It belongs to the class of drugs known as hydantoins and has been in use for several decades. Dilantin works by reducing the spread of abnormal electrical activity in the brain, thereby preventing seizures. One of the main advantages of Dilantin is its fast-acting nature. When taken orally, it is rapidly absorbed into the bloodstream, allowing for relatively quick seizure control. This characteristic makes it particularly useful in emergency situations where immediate intervention is necessary. However, it's worth noting that Dilantin is not suitable for all types of seizures and may be more effective for certain seizure types, such as generalized tonic-clonic seizures. Despite its efficacy, Dilantin is not without its drawbacks. It has a narrow therapeutic index, meaning that the difference between the effective dose and the toxic dose is quite small. This requires careful monitoring of blood levels to ensure that the medication remains within the therapeutic range. Additionally, Dilantin has the potential for numerous drug interactions, which may affect its effectiveness or increase the risk of side effects. These interactions can occur with other anticonvulsants, as well as with medications used to treat other conditions. Overall, Dilantin can be an effective choice for seizure control, especially in emergency situations. However, its narrow therapeutic index and potential for drug interactions should be carefully considered when choosing this medication as a long-term treatment option. What is Lamictal? Lamictal, also known by its generic name lamotrigine, is a newer anticonvulsant medication that has gained popularity in recent years. Like Dilantin, Lamictal is used for the management of epilepsy and belongs to a class of drugs called phenyltriazines. However, unlike Dilantin, Lamictal works by inhibiting the release of glutamate, an excitatory neurotransmitter in the brain, thereby reducing the likelihood of seizures. One of the key advantages of Lamictal is its potentially lower risk of side effects compared to older anticonvulsants. While all medications come with the potential for side effects, Lamictal is generally well tolerated and has a more favorable safety profile. This is particularly important for individuals who may require long-term treatment and want to minimize the impact of medication on their daily lives. Another benefit of Lamictal is its versatility in treating different types of seizures. It has been shown to be effective in various seizure types, including focal seizures, generalized tonic-clonic seizures, and absence seizures. This makes it a suitable option for individuals with different types of epilepsy. However, Lamictal also has some limitations. It requires careful titration to reach the optimal dose, as starting at too high a dose can increase the risk of serious skin reactions. Additionally, Lamictal may interact with certain medications, so it's important to discuss all current medications with a healthcare provider to ensure there are no potential interactions. In summary, Lamictal offers a more modern alternative to Dilantin, with potentially fewer side effects and a broader range of effectiveness. It may be a suitable choice for individuals seeking a well-tolerated anticonvulsant with a lower risk of drug interactions. How do Dilantin and Lamictal work in the body? Dilantin and Lamictal work through different mechanisms to control seizures in the body. Understanding how these medications function can provide valuable insight into their effectiveness and potential side effects. Dilantin works by blocking sodium channels in the neurons of the brain. By doing so, it stabilizes the cell membranes and reduces the abnormal electrical activity characteristic of seizures. This action helps prevent the spread of seizures and provides seizure control. On the other hand, Lamictal functions by inhibiting the release of glutamate, an excitatory neurotransmitter in the brain. By reducing glutamate release, Lamictal decreases the likelihood of excessive neuronal activity, which can lead to seizures. This mechanism of action makes Lamictal effective in preventing seizures and providing seizure control. The different mechanisms of action between Dilantin and Lamictal explain why they may be more effective for certain seizure types. Dilantin's sodium channel blocking action may be particularly effective in generalized tonic-clonic seizures, while Lamictal's inhibition of glutamate release may be beneficial in focal seizures. However, it's important to note that both medications can be used for various types of seizures, and the choice depends on individual factors, such as the specific type of epilepsy and the patient's response to treatment. In addition to their primary mechanisms of action, both Dilantin and Lamictal may also have secondary effects on other neurotransmitter systems in the brain. These effects can contribute to their overall anticonvulsant properties and provide additional benefits in managing epilepsy. Understanding how Dilantin and Lamictal work in the body can help individuals make informed decisions about their treatment options. Consulting with a healthcare provider is essential to determine which medication may be more suitable based on individual needs and seizure types. Efficacy and effectiveness comparison between Dilantin and Lamictal. When it comes to evaluating the efficacy and effectiveness of anticonvulsant medications, several factors need to be considered. These include the seizure types the medication is most effective for, the dosage required for seizure control, and the response rate in terms of seizure reduction. Dilantin has been used for many years and has a well-established track record of success in managing epilepsy. It is particularly effective in controlling generalized tonic-clonic seizures and may also be effective in other seizure types. However, the response rate can vary among individuals, and some may not experience complete seizure control with Dilantin alone. In such cases, additional medications or treatment options may be necessary. Lamictal, on the other hand, is also effective in controlling various seizure types, including focal seizures, generalized tonic-clonic seizures, and absence seizures. It has shown a high response rate in reducing seizures, with many individuals experiencing significant seizure reduction or complete seizure control. This makes Lamictal a favorable choice for individuals seeking effective seizure management. The dosage required for seizure control can also differ between Dilantin and Lamictal. Dilantin typically requires higher doses to achieve therapeutic effects, and blood levels need to be closely monitored to ensure the medication remains within the therapeutic range. Lamictal, on the other hand, often requires lower doses, which may be more tolerable for some individuals. Ultimately, the efficacy and effectiveness of Dilantin and Lamictal can vary among individuals. It is essential to work closely with a healthcare provider to find the right medication and dosage that provides optimal seizure control while minimizing side effects. Side effects and safety profile of Dilantin. Like any medication, Dilantin comes with potential side effects that need to be considered when weighing the benefits and risks of treatment. Common side effects of Dilantin include dizziness, drowsiness, unsteadiness, and problems with coordination. These effects may impair cognitive function and impact daily activities, so it's important to be aware of them. In some cases, Dilantin can also cause more serious side effects. These can include liver problems, blood disorders, skin reactions, and hypersensitivity reactions. Although these side effects are relatively rare, they can be severe and require immediate medical attention. Regular blood tests and close monitoring by a healthcare provider can help detect any potential issues early on. Another consideration when using Dilantin is its potential for drug interactions. Dilantin can interact with several medications, including other anticonvulsants and drugs used to treat other conditions. These interactions can affect the effectiveness of Dilantin or increase the risk of side effects. It's crucial to inform healthcare providers about all current medications to ensure there are no potential interactions. Overall, Dilantin can be a highly effective anticonvulsant for seizure control. However, individuals considering this medication should be aware of the potential side effects, especially those that can be severe, and discuss them with their healthcare provider. Side effects and safety profile of Lamictal. Lamictal generally has a more favorable safety profile compared to older anticonvulsant medications. However, it is important to be aware of potential side effects that can occur with Lamictal treatment. Common side effects of Lamictal include headache, dizziness, drowsiness, and gastrointestinal symptoms such as nausea and vomiting. These side effects are usually mild and tend to resolve over time. However, if they persist or worsen, it is important to consult with a healthcare provider. In rare cases, Lamictal can cause more serious side effects, such as aseptic meningitis, a potentially life-threatening condition. Symptoms of aseptic meningitis can include severe headache, fever, and stiff neck. Additionally, Lamictal has been associated with an increased risk of skin reactions, such as Stevens-Johnson syndrome and toxic epidermal necrolysis, particularly when starting at high doses. These skin reactions are rare but can be severe, requiring immediate medical attention. As with Dilantin, Lamictal can interact with other medications, so it's important to inform healthcare providers about all current medications to ensure there are no potential interactions. Despite the potential for side effects, Lamictal is generally well tolerated and has a lower risk of adverse events compared to older anticonvulsants. It is important to discuss any concerns or questions about side effects with a healthcare provider to ensure the benefits of treatment outweigh the risks. Factors to consider when choosing between Dilantin and Lamictal. When considering which anticonvulsant medication to choose, several factors need to be taken into account. These factors can help guide the decision-making process and ensure the selected medication is the most appropriate for individual needs. One of the primary considerations is the specific seizure type or types experienced. Dilantin may be more effective for generalized tonic-clonic seizures, while Lamictal has shown efficacy for focal seizures, generalized tonic-clonic seizures, and absence seizures. Understanding the seizure type can help narrow down the options and select the medication that is most likely to provide seizure control. Another crucial factor is the individual's response to treatment. Some individuals may respond better to Dilantin, while others may find Lamictal to be more effective. Discussing treatment options and potential response rates with a healthcare provider can provide valuable insight into which medication may be more suitable. Side effects and safety considerations are also important. Dilantin has a narrower therapeutic index and a higher potential for drug interactions compared to Lamictal. This may make Lamictal a more favorable choice for individuals who require long-term treatment or have other conditions requiring medication. However, it's important to have an open and honest discussion with a healthcare provider about potential side effects and safety concerns. Individual preferences and lifestyle factors should also be taken into account. Dilantin is known to have more sedating effects, which can impact daily activities and cognitive function. Lamictal, on the other hand, is generally well tolerated and has a lower risk of sedation. Considering these factors can help individuals choose the medication that aligns with their lifestyle and preferences. Ultimately, the decision between Dilantin and Lamictal should be made in consultation with a healthcare provider. They can provide personalized guidance based on individual needs, seizure types, and medical history. Patient experiences and testimonials on Dilantin and Lamictal. When considering anticonvulsant medications, it can be helpful to hear about the experiences of other individuals who have used Dilantin or Lamictal for epilepsy management. Here are a few patient testimonials that shed light on their experiences with these medications. Dilantin testimonial. I have been taking Dilantin for over 10 years to manage my epilepsy. While it has been effective in preventing seizures, I have experienced some side effects, such as dizziness and coordination problems. However, these side effects have been manageable, and the benefits of seizure control outweigh the drawbacks. Dilantin has allowed me to live a relatively normal life, and I am grateful for its effectiveness. Lamictal testimonial. I switched to Lamictal a few years ago after experiencing side effects with other anticonvulsants. I have been pleasantly surprised by how well I tolerate Lamictal. It has provided excellent seizure control, and I have not experienced any significant side effects. I am also pleased with the flexibility in dosing and the fact that it is generally well tolerated. Lamictal has made a positive impact on my quality of life. These testimonials provide insights into the experiences of individuals who have used Dilantin and Lamictal for epilepsy management. It's important to remember that individual experiences can vary, and what works for one person may not work for another. Consulting with a healthcare provider is crucial to determine the most suitable treatment option based on individual needs and medical history. Conclusion. Choosing the right anticonvulsant for epilepsy relief. Managing epilepsy requires finding the right anticonvulsant medication that provides effective seizure control while minimizing side effects.